organization for giving us the opportunity to be here today. My name is Elena Torrente. I work as Digital Health Deputy Director at DKV, and I am also in charge of our InnoLab of Digital Health. And previously, I worked in the public health sector managing some innovation projects. So today, what I will share with you first is a brief introduction on share some thoughts on innovation in digital health. I will then go into detail in what we are doing in our InnoLab of digital health. And I will finally close with some final remarks that I hope will be of interest to all of you. So to start with, I'd like to share this very interesting article of Atul Gawande. Most of you probably know him. He's a surgeon and public health researcher, author of books such as the Checklist Manifesto. And in this very interesting article called Slow Ideas, some innovations spread fast. How do you speed the ones that don't? He analyzes the very different trajectories of two innovations that took place in the field of surgery during the 19th century. These two innovations were anesthesia and antiseptics. And there were very different trajectories because while anesthesia had a very quick adoption, it became a standard in 7 years since the first public demonstration. Antiseptics was not this case. Antiseptics took decades after the first research published by Joseph Lister at middle of the 18th century. And the article analyzes why this happened, and he highlights two main reasons. One is that anesthesia was attacking one problem that was a very visible problem, an immediate problem, while antiseptics was attacking a problem that was not visible to the majority of the people, which was germs that in fact weren't seen well after the operation. And another idea is that while two innovations were making life better for patients, only one of them, which was anesthesia, was making life better also for doctors, because antiseptics required the surgeons to work with what was dangerous for them. So this comes to the three conclusions of the article, that is a change occurs when we really sense the need. Some innovations are attacking big problems that are invisible to the majority of the people. Second is that it is critical to understand existing norms. And third, that personal connection accelerates adoption. At the end, innovation is a social process, and communication is a key element to succeed. So having this in mind, we know about the potential of digital health to really improve health system performances. We know about the World Health Organization is saying that the potential of digital health on attaining sustainable development goals related with health, and also in achieving the WHO triple billion targets for 2023. That are around that 1 billion more people is getting access to universal health coverage, that 1 billion more people is better protected from health emergencies, and then 1 billion more people is having a better health. And on the other hand, we've seen all this potential of all this interest of investors in digital health, and this record last year on health tech venture funding. So we can ask ourselves, is really digital health having an impact on the system? Is really transforming it as we could foresee? Well, some would argue that definitely no. We know that, or not enough, or not for the moment. We know that the health sector has successfully implemented many technical innovations. However, investment in digital technologies have largely failed to lead to meaningful improvements along the axis of the quadruple aim. And so change is hard, and there are many reasons for that, but I would like to highlight three reasons that are the ones that are leading our work at Innovation Lab. The first one is about the identification of the need. Successful innovations really need to have a disciplined approach on attacking and analyzing unmet needs. following the theory of the jobs to be done, organizations should not ask customers or stakeholders which existing products they prefer, but they need to work on understand customers' underlying needs. And here there are plenty of techniques that come from other industries, such as design thinking or many methodologies that need to be applied in our sector. And really, a true innovation agenda in healthcare requires a focus on services to design high-value care and high-quality patient experiences. The second reason is about the complexity of the healthcare sector itself. We have in the middle the citizens, the patients that are receiving public health interventions and medical attention, social care attention provided by many different health professionals and different providers from the public and private sector. We have companies that are producing their products and services. We have the policymakers at different levels of governments at European, national, and regional level that have different competencies in the health arena. We have education and research, the academia with high standards on level of quality in terms of protocols and clinical trials. We have, and entrepreneurs need to know about the complexity of this sector, which is not easy and which makes it is really not transferable to the healthcare sector, the fact that it is not an industry such digitalized as other industries. And the third reason is about the delivery of value itself. How are you creating value? How and what your organization creates and delivers values, and which is the business model? In other words, who will pay for it? So when it comes to our innovation lab at DKV, what we are doing is we launched it at the beginning of last year. And it's the DKV's firm commitment to promote innovation in digital health. We've been working for the last 6-7 years on developing a complete digital health ecosystem for our customers. And this is like a step forward that we are taking as a company to really promote innovation in digital health. The aim of our lab is to promote research, development, and innovation in digital health, and to encourage the implementation of solutions to improve the health and well-being of the population. And here, with the three elements that we have seen, we have a team of experts on design health. We have a team with regards with stakeholders comprehension. We have the team of managers and experts in the insurance sector and the healthcare sector, and also our orientation to business models. The focus of our innovation lab is around health, is around determinants of health. We know that health is much more than medical attention, and that's why we want to pay attention to all the solutions that are tackling with all these aspects that influence health even more than healthcare. And we have developed our own framework, which is a smart positive health, that at the end is seeing what role can play technology to foster research and practice of positive health. Positive health is the scientific study of those elements that promote health assets being all that aspects and resources that the community or the individuals put to their disposal to have a better health and healthier life. And we think that technology can play an important role to improve, to activate all these assets. So that's why we have created the Living Lab in the Barcelona Health Hub headquarters. We have a space, a working area space, and a living lab environment that is composed by a consultation and a home, where we can test in real environment prototypes and technologies in this living lab. And we have focused on two main areas of work, research and development and open innovation. With regards with research and development, what we want here is to generate evidence on effectiveness of digital health and promoting research on value-based interventions using digital health. And to do that, we participate in public projects at the European level. We've been applying to Horizon 2020 and now to Horizon Europe. Also, we are partners of EIT Health since beginning of this year, and this will allow us also to participate in projects in EIT Health. We are also conducting market research on trends. We are conducting pilots, on-demand pilots, where we are testing technologies, and we are offering our living lab to the community to develop pilots and to design also digital health interventions. And we are fostering co-creation sessions that we are also doing with our community. We have created the Friends of InnoLab community that is composed by patients and professionals that want to participate in testing solutions and want to participate in this community. And we just launched it also this month. With regards with the open innovation, here we believe in open innovation to generate value. We want to share knowledge to generate value, and this is why we are opening our ecosystem to the community to look for the best solutions, sorry for that, that can be integrated in our ecosystem in order to enrich our value chain to our clients. Here we don't have a specific program, but we have on-demand calls, we have hackathons, specific calls that we launch to solve specific challenges. And we are in ongoing searching and scouting of startups of our interest. We have also developed our certification on smart positive health. This is a certification based in 5 parameters that we are evaluating in order to, as a first step, to integrate them solutions into our ecosystem in different ways of different levels of integrations. And finally, we are also offering services, specific services and programs to startups, mentoring programs, and specific services and programs that we are planning for them. So this would be our portfolio for startups, no matter in which part of the phase of the innovation project you are. We can collaborate in different ways. We can provide with market trends and market research in our main lines of activity, which are mental health, planetary health, behavioral change, all on the framework of smart health that we have seen. We can do early stage validation, testing in our living lab, mentorships, and also UX validation during the first phases of concept validation or solution development. We can go and explore the possibility to go to R&D, to R&D projects, to public projects, to public calls. And also in the phases of scaling up and the phases of commercialization for those startups that are in growth phase or scaling up, then we have the certification that we are providing, as I was saying, as a first steps to then be integrated in our ecosystem in different levels, as we can offer our distribution channels to the startups, or we can then integrate the solution in our health folder or completely in the workflow of our ecosystem. So as a use case that we wanted to share with you, we'll be launching in August, this summer, this proof of concept with Legit Health. Legit Health is a startup that has an artificial intelligence software for early detection of skin diseases. So we are integrating with them. They have an API that we have integrated so that our doctors can receive the results of the algorithm and they can inform our clients with the results. So it's a tool that we are using as a support tool for clinician tool, and for the users, for our customers, is transparent because they will be using our system as normally they use it, as they can do their virtual consultations, and they will upload the photo of the problem of the skin, and it's the doctor who will receive the Legit algorithm result, and then this will come back. The doctor is the one who will come back to the client, our customer, with the result. And with this, as expected outcomes, we expect to shorten dermatology waiting times, to improve customer experience due to this reduction of waiting times, and in the long term, to reduce costs. So, to finish, I'd like to share these 4 messages. The first is that digital is a means, it's not the end. We know about this. We all we are always listening about it, but I think it's worth never to forget it. That is really digital is not is only the means. Successful innovation in digital health has to do with many aspects, as we have seen. Really, the most important would be to meeting a real need, considering all the stakeholders, which are complex in our sector, the value and the delivery creation and the model transformation, and of course, this has a lot to do with change management and with leadership. And also that a crisis may transform, and we have to take the crisis as opportunities, and we have seen this with COVID-19. It really has changed the paradigm. We've seen a huge change and a huge increase before and after the crisis in the usage and the perception of the utility of telemedicine and digital health by citizens and patients, but also by professionals, which is also the most important. And to end with, I already said that at InnoLab, so we want to hear from you. So happy to welcome you at InnoLab and at Barcelona Health headquarters. Thank you for your attention.